So welcome all. Myself, K. MB, Assistant Professor, Department of Pharmacology, Channabasweshwar Pharmacy College, Latur. Today we'll discuss about anti-tubercular agents. So first of all, we will discuss about what is meant by tuberculosis. So tuberculosis is a potentially serious infectious disease that mainly affects the lungs. The bacteria that cause tuberculosis are spread from person to person through tiny droplets released into the air via coughs and sneezes. Means tuberculosis, which is a serious infectious disease and that mainly causes due to microorganism or bacteria, that bacteria which spread from one person to another by tiny droplets through coughing or sneezing. About 1/3 of the world population which is infected with Mycobacterium tuberculosis. So the causative agent of tuberculosis, that is Mycobacterium tuberculosis, and as per the WHO estimate, 9 million people globally develop with active tuberculosis, and in that 1.7 millions of people which die annually. In India, it is estimated that nearly 2 million people develops active disease every year, and about 500,000 of people die due to tuberculosis. Next, we will discuss about what is meant by anti-tubercular agents. So anti-tubercular agents, these are the drugs or agents which are used in the treatment of TB or tuberculosis. That agents are known as anti-tubercular agents. So we'll discuss about anti-tubercular agents classification. So look at the classification. So classification, it is classified into mainly two categories, that is first line drugs and second line drugs. So first line drugs, these drugs which have high anti-tubercular efficacy as well as low toxicity and are used commonly. So why they are called first line drugs? Because that drugs which is have high anti-tubercular efficacy and low toxicity, that's why we will prefer first. So examples of first line drugs such as Isoniazide, rifampicin, Pyrazinamide, ethambutol, streptomycins. So in front of that drugs, that showing some abbreviations, in short abbreviation, that is Isoniazide, which is indicated by H, rifampicin, which is indicated by R, Pyrazinamide, indicated by Z, ethambutol, which is indicated by E, and streptomycin, which is indicated by S. Now, second category of drugs, that is second line drugs. So second line drugs, these drugs which is having either low anti-tubercular efficacy or high toxicity or both. And these kind of drugs which are mainly useful for special circumstances only. So why they called second line? Because that drugs which is having low efficacy and which is high toxic effects. So that's why that's such drugs which is useful for special circumstances. So examples of second line drugs. So thiacetazone, then pus paramino salicylic acid, ethonamide, cycloserine, kanamycin, amikacin, then capreomycin, and some newer drugs. Again, comes under the category of second line drugs like ciprofloxacin, ofloxacin, clarithromycin, azithromycin, and rifabutin. So this is the classification of anti-TB drugs. So it is classified mainly into two categories: first line drugs and second line drugs. So first line drugs, which is having high efficacy as well as low toxic effects, while second line drugs, which is having low anti-tubercular efficacy and high toxicity, or both. So next we'll discuss about the pharmacology of isoniazide. So first of all, we'll discuss the pharmacology of isoniazide. So isoniazide, which is also known as isonicotinic acid hydrazine, and it is abbreviated with H. Isoniazide is the anti-tubercular drug and an essential component of all anti-tubercular regimens, unless patient is not able to tolerate it or bacilli are resistant. Means isoniazide, it is a very important drug during the treatment of anti-TB, because of through isoniazide, that patient which is not able to tolerate with INH, and also bacilli resistance also prevented through this isoniazide. So isoniazide, which is primarily tuberculocidal action, means it kills Mycobacterium tuberculosis bacteria, fast multiplying organisms, which is rapidly killed, but quiescent ones are only inhibited. It acts on extracellular as well as intracellular tuberculosis bacilli, and is equally active in acidic as well as in alkaline medium. Again, isoniazide, it is the cheapest anti-tubercular drug, and however, most of the atypical mycobacteria which is not inhibited by INH, so other mycobacteria, most of the other mycobacterium which is not inhibited through this isoniazide. So look at the structure of that isoniazide. So this is the structure of isoniazide. Now we'll discuss the mechanism of action. So mechanism of action of INH. The antimicrobial activity of isoniazide is selective for mycobacteria, likely due to its ability to inhibit mycolic acid synthesis, and that mycolic acid synthesis which interferes with the cell wall synthesis, and thereby that isoniazide which produces bactericidal effect. Means mycolic acid synthesis, which is very important for the cell wall synthesis of bacteria, but INH, which is mainly targeted on that inhibition of mycolic acid, means through the inhibition of mycolic acid, it inhibits cell wall synthesis and it shows bactericidal effect. A gene labeled INHA, which encodes for fatty acid synthetase enzyme, is the target of INH action. The sensitive mycobacteria concentrate isoniazide and converts it by catalase peroxidase enzyme, that is CATG, into an active metabolite that interferes with the INHA gene. Means INH, it is a prodrug. After metabolism by that catalase peroxidase enzyme CATG, it converts into their active form, and which shows the inhibition of mycolic acid synthesis. The active species isonicotinic acyl radical or anions, which is derived from CATG. That INH activation which reacts with nicotinamide adenine dinucleotide NAD to form INH-NAD adduct, and then it attacks with a gene INHA. Means after that, INH converts into its active form by CATG, and that INH which forms adduct or complex with NAD, and that adduct which may attacks INHA gene, and hence it shows inhibition of mycolic acid synthesis, which finally results in cell wall synthesis inhibition and shows bactericidal effect. So look at the mechanism here. So that shows a cycle-wise mechanism, and here that's showing the mechanism in the cell. So first of all, that INH which enters in the mycobacteria, then it converts into their active form. That active form which binds with enzyme, that it makes adducts with NAD, and that adduct which inhibit mycolic acid synthesis. So mycolic acid synthesis inhibition, which can leads to weaken the cell wall, and finally it shows tuberculocidal effect. Okay, so simply that cycle-wise mechanism of action, which is shown in this slide. So this is again shown in the bacterial cell wall. In the bacteria, how INH shows their mechanism of action. Then pharmacokinetics. So pharmacokinetics of INH. So INH, which is completely absorbed orally and penetrates all body tissues, tubercular cavities, placenta, as well as meninges. Isoniazide is extensively metabolized in liver, and most important pathway in the metabolism. So it metabolizes by acetylation, and that metabolites after acetylation, which is excreted through the urine, and the rate of INH acetylation, which is depends upon genetic variations. Okay, so the rate of INH acetylation shows genetic variations, means some of the person which shows different rate, and some person shows different state. So look at the here. Look at here. Here there are some reports of that variation in the excretion rate. So here some of the Indians, that is 30 to 40% of Indians, which shows fast acetylators. That's why the plasma T-half of INH is 1 hour, and 60 to 70% of Indians which show slow acetylators, and hence the plasma T-half of INH is 3 hours. Okay, so 30 to 40% of Indians which shows fast acetylators, and 60 to 70% of Indians show slow acetylators. So that is the excretion rate, which is depends upon the genetic variation. Now drug interaction. So drug interactions of INH. So aluminum hydroxide inhibit INH absorption. In second drug interaction, isoniazide inhibits metabolism of some drugs like phenytoin, carbamazepine, diazepam, warfarin, and due to inhibition, the metabolism of such drug, it increases or rises their blood level, means it shows toxicity of such drugs. Next drug interaction, isoniazide with para-aminosalicylic acid, so PUS, which inhibits INH metabolism and which prolongs the plasma T-half of INH. So these are the drug interactions, INH with other drugs. Now we'll discuss about adverse effect. So look at the adverse effect of isoniazide. So isoniazide, which shows peripheral neuritis, then paresthesia, then it shows numbness, it shows mental disturbances, rarely it produces convulsions, it shows hepatitis, rashes, fever, acne, and arthralgia. Arthralgia means muscle pain. So these are the number of adverse effects of isoniazide. Last, uses. So use of isoniazide. So isoniazide is used in the treatment of tuberculosis infection. Means it is used as an anti-TB drug. In combination with other drugs, it may be used alone for prophylaxis of TB. Means that isoniazide in combination with other drugs like rifampicin, ethambutol, pyrazinamide, that isoniazide which is used in combination in the prophylaxis of TB. Okay, so this is about pharmacology of isoniazide. Now next drugs under antitubercular category, that is first line drug, rifampicin. So rifampicin, it is a semi-synthetic derivative of rifamycin B, which is obtained from a fungus Streptomyces mediterraneae. Rifampicin is a bactericidal to Mycobacterium tuberculosis, as well as many gram-positive and gram-negative bacteria like Staphylococcus aureus, then N. meningitis, H. influenzae, E. coli, Klebsiella, Pseudomonas, Proteus, and Legionella. Against tuberculosis bacilli, rifampicin, it is an efficacious as like isoniazide, better than all other drugs. The bactericidal action covers all subpopulations of tuberculosis bacilli, but acts best on slowly or intermittently dividing ones, as well as on many atypical bacteria. So as compared to isoniazide, so rifampicin, which is having a wide or broad spectrum effect as compared to isoniazide, means that rifampicin, which is widely used, or it is used in the treatment of many atypical mycobacteria, while isoniazide, which is not effective in atypical mycobacteria, other atypical mycobacteria. Both that rifampicin, isoniazide, which acts on extra as well as intracellular organisms, and it has good sterilizing as well as resistance preventing action. So this is about introduction of rifampicin. Now we will discuss the mechanism of action. Mechanism of action of rifampicin. So rifampicin, which inhibits bacterial DNA-dependent RNA synthesis by inhibiting DNA-dependent RNA polymerase enzyme. During protein synthesis process, we already know, during the formation of mRNA, so mRNA which is formed or produced or synthesized by DNA, by the activation of enzyme RNA polymerase. But here rifampicin inhibits that DNA dependent RNA polymerase enzyme, and hence it inhibits mRNA synthesis, and finally it inhibits the protein synthesis. So look at the mechanism of action. So rifampicin binds to bacterial DNA dependent RNA polymerase enzyme. After binding with RNA polymerase enzyme, it inhibits RNA synthesis, that is it inhibits mRNA synthesis. So due to inhibition of mRNA synthesis, there is no protein synthesis occurs. No protein synthesis occurs means in the mycobacteria, no growth and no multiplication of bacteria. And finally, no growth and no multiplication means rifampicin shows bactericidal effect, means it shows killing of mycobacteria. Rifampicin shows killing of mycobacteria. So this is the stepwise mechanism of action of rifampicin. Next, pharmacokinetic. So rifampicin, it is well absorbed orally, widely distributed in body, and penetrates all cavities, placenta, as well as meninges. It is metabolized in liver to an active deacylated metabolite, which is excreted mainly through the bile, and some of the drug also excreted through the urine. The plasma TF of rifampicin is vary, so it is about 2 to 5 hours. So this is about pharmacokinetic of rifampicin. Now drug interactions. So drug interactions of rifampicin with other drugs. So rifampicin enhances its own metabolism as well as that of many drugs like warfarin, oral contraceptives, corticosteroids, sulfonylurea, digoxin, steroids, theophylline, metoprolol, fluconazole, ketoconazole. So rifampicin, which enhances its own metabolism as well as other many drugs. So due to that, it reduces their effect. In second drug interactions, contraceptive failure occurs with rifampicin. So it switch over to an oral contraceptive containing higher dose to estrogen, or use of alternative method of contraceptives, means that rifampicin which lowers the effect of contraceptives. That's why lower the effect of that contraceptive, oral contraceptives. So we have to use other technique, other contraception technique during the treatment with rifampicin. Next, adverse effect of rifampicin. So rifampicin, it shows hepatitis, respiratory syndrome, purpura. Purpura means leaking of blood from small capillaries. It shows hemolysis, shock, renal failure. It shows cutaneous syndromes such as flushing, rash, redness, watering of eyes. It shows flu syndromes such as chills, fever, headache, malaise, bone pain. It also shows some of the abdominal syndrome like nausea, vomiting, abdominal cramp with or without diarrhea. So these are the adverse effects of rifampicin. Now we will discuss about uses of rifampicin. Rifampicin is mainly useful in the treatment of tuberculosis. It is also useful in the treatment of leprosy, means it is also used as an anti-leprotic drug. So it is also used in the prophylaxis of meningococcal as well as H. influenzae meningitis. It is also useful for Legionella infections, and combination with doxycycline. It is a first-line therapy for the treatment of brucellosis. So this is about rifampicin. Now next drug, we'll discuss about pyrazinamide. So pyrazinamide, it is abbreviated by Z. So it is chemically similar to isoniazide, and that pyrazinamide, which was developed parallel to it in 1952. Pyrazinamide, it is a weakly tuberculocidal, but it is more active in acidic medium. It is highly effective during first 2 months of therapy when inflammatory changes are present. By killing the residual intracellular bacilli, it has good sterilizing activity and mechanism of antimycobacterial action of pyrazinamide, which resembles INH, means it inhibits mycolic acid synthesis. As like isoniazide, pyrazinamide, it also inhibits mycolic acid synthesis, which can lead to inhibition of cell wall synthesis, and it shows weak tuberculocidal action. Now we will discuss the mechanism of action of pyrazinamide. Look at pyrazinamide. It is act as again a prodrug. So pyrazinamide. So it encodes with the PNCA gene, and when encoding with that PNCA gene, so it converts pyrazinamide by pyrazinic acid through the enzyme pyrazinamidase. So pyrazinamidase, that enzyme which converts pyrazinamide into pyrazinic acid, which is the active form, and that pyrazinic acid that shows bactericidal effect. Okay, so this is the in short mechanism of action of pyrazinamide. Now pharmacokinetics. So pyrazinamide, which is absorbed orally, it is well distributed in body, and it has good penetration in cerebrospinal fluid. Pyrazinamide, which is extensively metabolized in liver and mainly excreted through the urine. The plasma T-half of pyrazinamide, which is 6 to 10 hours. Then we will discuss about adverse effect of pyrazinamide. So pyrazinamide, it shows hepatotoxicity, then hyperuricemia. Hepatotoxicity, nothing but the damaging of liver. Hyperuricemia, so increase in uric acid level in blood. Then arthralgia, that is muscle pain. Flushing, redness, it shows rashes, it shows fever, and also it results loss of diabetes control. So these are the number of adverse effect of pyrazinamide. Now last, we will discuss about what are the uses of pyrazinamide. So pyrazinamide, which kills or stop the growth of certain bacteria that causes tuberculosis, means it is mainly useful in the tuberculosis infection. It acts as an anti-tubercular drug. It is also used with other drugs such as isoniazide or rifampicin to treat tuberculosis infection. So this is about therapeutic uses of pyrazinamide. So we have discussed about the pharmacology of pyrazinamide.